thank you to our sponsor, MBA Growth Partners.
Welcome to Studio 501c3. I'm Kim Jones, CEO of the nonprofit Village, which increases capacity and provides shared space for charitable organizations. Our show features nonprofit organizations that provide essential programs and services. They're charities that the IRS has designated as 501c3 because they provide a public benefit. And in most cases, your donations to these organizations are tax deductible. Nonprofit Village is also a proud partner of Montgomery Community Media, and MCM is your public access resource that provides a variety of information and programs relevant to Montgomery County. On today's episode, I'm talking with Carri Guthrie Cho, President and CEO of Cornerstone Montgomery. Cornerstone empowers people living with mental health and substance use disorders to thrive in the community through collaboration, treatment, education, and advocacy. Carri, thanks for joining the show.
Thank you so much, Kim. I'm really happy to be here.
Well, let's start. We don't have much time. So you, not you personally, but you, Cornerstone, has provided the behavioral health services for nearly 50 years. And I think you are the largest provider of these services in the county. Is that correct?
Yes, we are. We are the largest provider in Montgomery County of behavioral health services. We have been around for just over 50 years, and we serve about 3,000 people a year. We are only located in Montgomery County, which is a bit unusual for an agency of our size. We are a $28 million organization, and we have about 350 staff, and we provide a wide range of services in the public behavioral health system. So we have everything from housing to case management to outpatient mental health clinics with psychiatrists and therapists to residential services.
When you say housing, does that mean is that a residential program for?
We have a couple of different housing options.
Oh, okay.
We have our residential rehabilitation program, which is 224 beds, where people have roommates, usually 2 or 3 roommates. Sometimes we have 8-bed houses. Those are 24-hour group homes where there's a range of staffing. And this is where people need support. Sometimes it's 24 hours staffing, and sometimes it's just drop-in staffing. But the type of housing does include services. So people have to be willing to come in and get the housing, but also get the services.
And I'm sorry, I interrupted you, but go on, because
Okay.
you were talking about the other clinical programs and other things. So please tell us a little bit more about some of those other programs.
Sure. We also have residential crisis services. We have 24 beds in 3 houses in the community, and those are an alternative to a hospitalization or even a step down from a hospitalization for people who are having a psychiatric crisis. And then we also have our outpatient mental health clinics where we have crisis services there as well, but also psychiatrists and therapists and nurses who provide services. And then we have an employment program. We actually serve over 700 people in that program. It's the largest in the state. And we help at least 60 to 65% of them find, get, and keep jobs every year. Although I will admit that COVID has had a bit of an impact on that program. But it is one of our star programs and has some great outcomes.
So with the programs, do people have to be referred? Can they come in on their own, take advantage of different programs? What kind of process happens when people are coming to you for service?
It depends on the program, but in general, because we are part of the public behavioral health system, we serve people who are eligible for Medicaid and Medicare, are low income. So that's what we usually serve. All of our services are covered by Medicaid. We do have a handful, our outpatient clinic services and our residential crisis services are also covered by private insurance, Care First, Cigna, Optum. Those are also covered by those insurers. So in those situations, people can be directly referred, but some of our programs, like our residential rehabilitation program that I mentioned earlier, those referrals come to us through the county. They maintain the waiting list for all of the beds that are in the county. There are 2 other organizations that have residential beds, and those come to us from the county. Other than that, people can refer directly or do walk-ins for intakes and things like that.
Wow. And the programs exist in their locations throughout the county, or is everything centrally located?
So we actually have 85 properties. Most of those are houses and apartments, condos, townhomes, and they're all over the county from Tacoma Park to Germantown. And then we have 3 of those buildings are commercial buildings. Like we call them our hubs. And we have services are located in each of those hubs. The clinic, there's office space for supervisors. Our day program is located out of those hubs, things of that nature. And then all of the other properties are houses. We do also lease some apartments in the residential program, but we own over 65 properties all over the county.
This is awfully complex,
Yeah.
but essential services and so comprehensive. It's amazing all that you're doing and how it all fits together. So, one other question that I had was about, I think you also mentioned professional training programs. I think you do some professional.
Yeah,
training.
absolutely. Actually, it's one of the things I'm very proud of as well. We have an amazing training program for new staff coming in, but we've opened that up externally. We have national accreditation, so we can provide CEUs for licensed professional counselors and licensed social workers. And we open that up to anyone who wants to attend. So we have training programs such as motivational interviewing, co-occurring disorders, cognitive behavioral therapy, and you can see all of those on our website.
Okay, all right. I know that you do a lot of collaborating also, because I read about it. So just as we go to a break, can you just quickly talk a little bit about some of the collaborations in the community?
Sure, that's one of our favorite things to do is partner and collaborate with other people. In fact, in the building that I'm in now in Rockville, we own this building and we're the landlord to the 70-bed women's shelter that's in the basement of this building. Interfaith Works runs that shelter for the county, and we partner with them on a daily basis. We also partner with Montgomery County Coalition for the Homeless. We also partner with Nexus Montgomery, which is the collaboration of all of the hospitals in the county, and we work very closely with them as well. It's something that we find very important. We also collaborate with the mental health court.
Sure.
In the judicial system.
Well, we can come back and talk a little bit more about that, but right now we need to take a short break.
Okay.
And when we come back, we'll hear more about that program, the collaborations, and everything else that you're doing with this large organization. Studio 501c3 on Montgomery Community Media. We'll be right back.
Today I'm going to talk to you about physics. Come on in, girls. Let's go. This is the first rocket to get humans to Mars.
Really tall.
I'm a rocket structural engineer designing and building parts of the rocket. You are the generation that will be stepping foot on Mars. Do I have a group of astronauts on my hands?
Yes.
You can become a rocket scientist or whatever else you want to be.
Can I get the now bar, please?
$1.
Have a good one. Got it.
Hey, what's going on?
Hey.
Hey, let me get a now bar.
Sure. $1.
Appreciate you.
You got it.
There are 16 million children struggling with hunger in America. This is a serious problem, but one we can solve. Visit feedingamerica.org to help. Together we can solve hunger. Together we're feeding America.
Welcome back to Studio 501c3, your window into exceptional nonprofit programs in Montgomery County. I'm talking with Carri Cho, the president and CEO of Cornerstone Montgomery. So, Carri, before the break, you were talking a little bit about collaborations, and we know from all of you that are doing this very important work in the community, and Montgomery County being a model for working with those who have behavioral health issues or are experiencing homelessness or food insecurity. We have become this model for many other cities. But this pandemic that we've been through has had such an impact. What has been the impact specifically on the whole behavioral health system?
Well, I think it's pretty much what you're hearing about in many of the worlds that we are living in. It's really impacted our staffing. I will say specifically the Omicron variant has decimated our staff. We have so many staff who are now needing to, quarantine, or who actually contract the virus and have to stay home. And that's really impacted our ability to provide all the services that we're used to providing to the clients. It's had a huge negative impact the last 2 months in particular.
Wow. What kind of things do you have to deal with and put in place in order to counter that? Is it reduction of services? Is it expansion of recruitment? How do you even counter that?
We've done a little bit of all of those things, plus some other things. We've tried to incentivize covering shifts with kind of what we're calling a sub bonus for some of our staff who can sub at different departments. We have upgraded our recruitment. We're hiring more subs, people who aren't full-time employees, but can come in and cover shifts at various locations. We've hired more of those in the last 2 months than I think we have in years.
And do any of those collaborations that you talked about earlier, working with Interfaith and the coalition, does that help at all? Because everybody's dealing with the same thing.
Yeah.
Are you able to?
It can be a challenge because we're often competing for the same employees.
Yeah.
And if someone's paying more than another person, it can definitely be a challenge. We just try and respect each other and don't poach staff, and we work together and just know that we're all dealing with this issue and struggling. It's been incredible the amount of turnover that we've had. And then for people who are still here, the impact just that the variant has had on us in the last couple of months. And I know everyone's experiencing the same thing. So we just try and support each other through that.
Right. Well, what about volunteerism? The work that you're doing is very specialized and probably requires specific training, but are there any opportunities for people in the general public to volunteer?
Honestly, COVID has kind of limited that because we haven't wanted to bring people in with exposure and concerns like that. We do have occasional volunteers to help with behind the scenes clerical things, bringing donations to different programs. It's been a struggle with staffing issues. So we've had a lot of volunteers who brought meals to some of our group homes, and usually we handle the cooking ourselves with the clients. It's part of their rehabilitation. But sometimes on the weekends, it's been helpful to have people donate meals and bring those. That's not something that we've done very often over the years, but that is something that has come up recently that has been helpful. So volunteers has been particularly challenging with COVID.
And when you talked about some of the things that the volunteers are doing and the things that they're bringing to different places, just as we wrap up in the last 30 seconds, what does a donation mean? Either a financial donation or an in-kind or any kind of other donation. What will that mean to the organization?
Any donation is absolutely critical and helpful. Because of the staffing issues, I'll be honest, our revenues are not what we expected them to be. So any donation that can just go to general ops or to the bottom line is a huge help in offsetting some of that loss that we're experiencing the last 2 years. I will say we have a great financial department. We manage things very well. Cash flow hasn't been an issue. We're doing well in general. However, anything that can help offset some of that deficit would be great. It's very easy to donate on our website, or we of course happily accept checks as well.
And we do have your website that's going up on screen. Carri, we're out of time, but you've given us a great deal of insight into the services of Cornerstone Montgomery and the many ways that people can either use the services or become engaged when it's safe to do so. And I just want to thank you for being here and sharing this information.
Oh, thank you so much for having me. I really enjoyed it.
For more information on Cornerstone Montgomery, visit their website at cornerstonemontgomery.org. I'm Kim Jones. Thanks for joining us, and come back for another edition of Studio 501c3 on Montgomery Community Media.